Hello there. Today I'm going to share with you something concerning diet following bariatric surgery. Diet following bariatric surgery follows 5 main stages, and today's video is going to clarify these stages and make it very simple for you to remember. After any bariatric operation, whether it is balloon surgery, whether it is sleeve gastrectomy, whether it is gastric bypass, or whether it is a revision surgery, we follow these stages to give you a smooth recovery. In bariatric surgery, there is manipulation of the stomach and the intestine, and most of the times there are stitches, or what we call a stapling that is done on the stomach. So we want it to have time to recover. This is to avoid not only vomiting but also to avoid leakage or disruption of those stitches, disturbing those stitches. So the first stage is called as the clear liquid stage. When I say clear liquids are liquids that if you have it in a glass, you can see through it. It's transparent. For example, this is clear. You can see me. You can see through this glass. Okay, so this is clear liquid. This could be water, it could be green tea, it could be clear soup, it could be anything that is transparent, does not have any particles. So this is safe. It started as a first stage. So in this stage you need water inside, you need to hydrate yourself, but at the same time you do not want to take anything that will disturb your internal lining or stimulate vomiting and disturb the operation. Okay, the second stage is full liquid stage, or all liquids, but mind you, once again, they are liquids. So when I do mention about this second stage or full liquid stage, I also tell them, please remember this filter, something like this, that you need to let everything that you drink go through this first. And this avoids that you do not have vegetable pieces or chicken pieces, meat pieces, or or a fruit substrates, things that can block your narrow pathway. So you need to filter all liquids that you take, and this prevents you from actually having problems when you're taking these all liquids, because when you make soup or when you have smoothies or when you have anything, then there can be particles inside. It could be some leaves, it could be some vegetable particles, or seed particles. So we need to see that they're all strained away. So this is a straining stage or a filtering stage where you filter everything and you have it. So this liquid phase lasts 2 weeks. The first week is clear liquid, second week is all liquids but filtered through a filter like this or a strainer. So the third phase is a phase where you have pureed diet phase. Pureed means that which is made into a paste or blended, which is easy to take with a spoon, like how you feed a baby who has no teeth. So that's the pureed stage, and I recommend strongly that you have a blender. Remember, a blender of this sort. There are many kinds of blenders in the market. You can use that and blend everything that goes inside. So this is the blending stage or a pureed stage. And then we come to the fourth stage, where you are able to take soft food and chew it nicely. Remember, when you have solid food or semi-solid or pasty food, you need to chew it and swallow it slowly. There are reasons why we ask you to swallow slowly, because your food pipe and the narrow tube that is made, whether it is sleeve gastrectomy or even gastric bypass, mini gastric bypass, this needs time to push the food downwards. So it needs to have that time gap between two portions of food that you swallow. And not only that, you can stimulate your intestinal hormones better and quicker and have the best effect if you chew and swallow slowly. So previously, before operation, if you were in a habit of gobbling up food in a hurry and finishing it soon, you have to slow it down. You have to chew all your solid food and swallow slowly and take long intervals in between, so that the food reaches the intestinal parts where hormones can kick in into your system and work the good results of the operation. And also it avoids dumping and other related issues if your food is especially having carbohydrates. So without going to too much details in this talk, I have given you 4 stages, and the 5th stage, I would call it as a nutritious food stage, where you make the right choices. You make sure that your small digestive receptacle system that you are given after the operation is not overloaded with the wrong choice of food, and thereby preventing the nutritious food. So you need to get a good chart from the dietitian, the foods that are good for you and foods that needs to be avoided. So this in short summarizes or gives you the 5 stages or the 5 phases of diet following bariatric surgery. First stage, stage of clear liquids. Second stage, stage of full liquids or all liquids provided they are all strained. Third stage is a stage of blended or pureed food. Fourth stage, stage of soft or solid food but chewed nicely. And fifth stage is all nutritious food, again eating slowly, chewing systematically, and giving gaps between 2 portions of solid food. So this summarizes the diet after bariatric surgery, and this can be applied for most of the bariatric surgeries that are being conducted. So if you have any more questions, you can reach out to me. I am Dr. James Zachariah, head of the Department of General and Bariatric Surgery in Zuleika Hospital, Dubai. My contact number is given across the screen. In fact, you can also visit my website www.obesity-khalas.com www.obesity-khalas.com. You can visit, or you can WhatsApp me your intent to know more or to meet with me or to have an appointment with me. Remember, first appointment is free, and we have special consideration for those who are seeking advice for their bariatric surgery. So see you then. God bless you. Take care.